everything you need to know about symptoms, treatments, risk factors, and relapses so that living with bipolar depression is a little more manageable. Whether you've just been diagnosed with bipolar depression, suspect you may have it, or someone in your family has it, you may be wondering what the next steps are and what this label really means. We've talked to the experts, read the research, and listened to people who have bipolar describe what it's really like. Here, we're going to share with you everything we've learned along the way, including an as-told-to story from a couple facing the challenges of bipolar disorder and how they deal, a report on new treatments, and a piece describing what the symptoms feel like, dispelling the common misconceptions. Let's start with what it means to have a bipolar disorder diagnosis. Bipolar disorder is a condition that essentially hijacks your moods. We'll get more into how in a sec. Just under 3% of the US population has bipolar, though many of those people, up to 40%, were first diagnosed with depression. That's because people who have bipolar disorder experience a lot of the same symptoms as those who are depressed. The difference is, when you have bipolar, you'll also have episodes of mania, sometimes called hypomania, if it's less extreme, because the manic episodes are the key distinguishing factor from regular depression. Up until recently, bipolar disorder was referred to as manic depression. Types of bipolar. Not all bipolar is the same. There are 3 types. Bipolar I. Periods of severe mood episodes from mania to depression, which may require hospitalization. Bipolar II. Periods of less severe mood episodes from a milder form of mood elevation, involving episodes of hypomania that alternate with periods of depression. Cyclothymic disorder. Moods cycle between brief periods of hypomanic symptoms and brief periods of depressive symptoms. Neither are as extreme or long-lasting as with bipolar I or bipolar II.
Symptoms of bipolar. Bipolar is almost like 2 diseases in one. To be diagnosed, you need to have both manic or hypomanic symptoms and depressive ones. But even still, the depressive symptoms are far more frequent than the manic ones. For those who have bipolar I, the depressive symptoms occur about 3 times as often as the manic ones do. And for bipolar II, there are even more depressive episodes, at a ratio of about 40:1. This explains why so many people with bipolar are misdiagnosed with depression at first.
Depressive symptoms related to bipolar may include low energy, low motivation, loss of interest, sadness, feeling empty, hopelessness, significant weight loss, fatigue, indecisiveness, inability to concentrate, insomnia. Manic symptoms related to bipolar may include abnormally upbeat, euphoric, jumpy, wired, racing thoughts, pressured speech, abnormally talkative, sometimes jumping from topic to topic, feeling like you don't need as much sleep, poor decision-making and risk-taking, being easily distracted, irritable or impatient, overly self-confident, feeling grandiose. Why bipolar is tricky to diagnose. Bipolar disorder may go unrecognized for up to a decade. Misdiagnosing it as depression is part of the reason. But the fact that there isn't a single, definitive test that says, yep, you have bipolar, also contributes to it slipping through the cracks. Doctors have to rely on how their patients describe the way they're feeling, or how their loved ones describe it. This isn't to say it's arbitrary. There is at least one screening test called the Mood Disorders Questionnaire, MDQ, which was developed to assess lifetime history of mania and hypomania. It's a simple checklist of 13 symptoms and a couple of questions about timing and severity. Like with other disorders, psychiatrists and researchers are starting to recognize that bipolar can be thought of as a spectrum, not just a series of symptoms where you either check the box or you don't. Different people can experience bipolar in very different ways, whether that means the ratio of depressive cycles to manic ones, having mixed episodes, where you feel both euphoric and down, or the ways the symptoms manifest. For some people, pressured speech may be the giveaway of a manic phase, for another it may be risky behavior.